Okay, so we're just going to run through a demonstration of cannulating a patient's vein. So as you can see, I've got set out using a sterile field. Depending on where you work will depend on what's provided. But we have here a way of ensuring that this is as sterile a process as possible using a non-touch technique. So I've got my equipment, which has come from a sterile pack. I've checked the date, I've checked that it's intact. So, decontaminating hands. So I'm now in a position to inspect my patient's arm. I'm going to select the less dominant arm if possible, because the cannula is going to remain in place. I don't want, if they're right-handed and doing lots of things with their right arm, for instance, to use that arm. So I'm going to select an arm that isn't dominant and that has got some good veins. There's no bruising, no signs of infection, etc. So I'm going to apply the tourniquet, similar principles to venipuncture, making sure that it is sufficiently tight so as not to cut off circulation but to help to dilate the vessels. Should still be able to feel a pulse in the arm. So, palpating, nice bouncy vein, and I've got a lovely one here that is nice and bouncy, so I'm going to go for that one. Take the tourniquet off because I don't want that being on for any great length of time, and then I can decontaminate my hands again. Right, so I'm now going to clean the area using my alcohol and chlorhexidine wipe. As I say, checked that it's all in date. And the same as with venipuncture, up and down and side to side for 30 seconds and leave to dry for 30 seconds. Okay, so now I'm going to reapply the tourniquet and put on my gloves, again making sure that they are well-fitting gloves, not too big and not too small. Feel like Goldilocks in the bears. Right, so I've got my cannula. Now people do this and hold this piece of equipment in different ways. I'm just showing you the way that I hold it. So I bring the wings out and make sure that it's all intact, take off the cap, again with the bevel uppermost, similar to when doing venipuncture. We make sure that the bevel is uppermost and securing the vein below where we're going to puncture and making sure that our needle doesn't come into contact with the glove, holding at a 30-degree angle, puncture through the skin. And you feel a slight give, more so when you are more experienced. And if you can see if I just let go, you can see here we've got flashback. So I know I'm in the vein. So I'm just going to advance that slightly further. And then this is the trick. You need to hold this hand still. So I've got my finger securing it to the skin, holding on to this part of the cannula. And with my right hand, I'm just going to slide the plastic in so the needle won't go any further. And we're in the vein. So at that point, the tourniquet can come off. We don't need that dilated vessel anymore. I'm going to take the cap off the end of my cannula. You can ask your patient to raise their arm to help with gravity to stop that blood, because there will be blood that comes out. And reassure the patient, nothing to be alarmed about. Slide that out, slightly more blood coming out with this mannequin than you might expect. So I've got my sterile gauze that I can use from my pack to wipe around. As I say, it is slightly excessive, the amount of blood that's come out through the mannequin. But if somebody's on anticoagulants, they may well bleed quite a bit, or if they've got high blood pressure. So now that's in that position, I'm going to secure the cannula with my dressing. So the dressing's on, so my cannula is secured. As you can see, the safety needle has resheathed itself, and so we can put that straight into the sharps bin with a reduced risk of needle stick injury. Now that that cannula is secured, I'm wanting to flush it to make sure that it's still in the vein and to stop the blood from clogging it off. So with 5 ml of saline and using a push and stop technique to cause turbulence to clean off that blood, just give it a flush. There shouldn't be any discomfort from the patient. They may complain of cold sensation going up their vein, up their arm, but it shouldn't be painful, and you shouldn't see a 5 ml rise in skin here either. Some people talk about aspirating back to check whether it's still in the vein. Or you can just flush it and look out for those signs. And then ensure that accurate documentation of the equipment, the batch number, expiry dates, etc. And write and document whether there have been any difficulties or issues with the procedure. Okay, so I'm going to show you now how to take blood when you've got a fresh cannula in. So you would only take blood from a cannula once the fresh cannula has gone into place. You wouldn't take blood if the cannula had been in for a long time. Some areas will require you to do an additional puncture, so do venipuncture separately to the cannulation. But there is an option. So before you take the needle out, again, people do this slightly differently. So you could take the white cap off. Now you do need to be careful with the white cap that you protect the inner bit that's going to go into the patient. So I'm going to pop it down on my sterile field, and I've not touched the end. So that's ready to go on when I've finished. So instead of a Vacutainer needle, I've got a Vacutainer, what I call a nibbly bit, and that is going to go in place of the needle when I take it out. So I'm going to hold on to the needle part. I'm going to apply pressure at the end of that cannula on the vein and lift up my patient's arms slightly. Take that out and put in that nibbly bit. So there now I can push on my blood bottles using the shoulders and my thumb to push on, and making sure that I don't push or pull the cannula out. So that will automatically fill up, and when that's finished I can take that out and get ready to put my cap on. Again, making sure that I don't touch that end piece. I'm going to just loosen this off slightly, apply pressure to the end of the vein, lift the arm up and apply the cap. I'm then in a position where I can flush the cannula, where I can put the dressing on and secure it. And make sure that you label the blood bottle at the patient's bedside before leaving. I'm going to put my sharp straight in the sharps bin, and then I'm in a position to take my gloves and apron off and decontaminate my hands. Okay, so we're just going to show a reasonably straightforward process of taking a cannula out. No scissors should be used, no matter how clogged up with dressing sometimes the cannulas get. What we don't want to do is cut through the plastic cannula itself, which will then end up floating around somebody's bloodstream. So obviously we've gained consent, explained what we're going to do to our patient or for our patient. And dressings, there are easy ways to take dressings off, and often that's not, people aren't aware of it, and it's actually pulling a dressing away from the position that you want to peel it off in, and that actually loosens the dressing. So just pulling it away will help to loosen it off. And just keep it secure. Come on, sticky. And then using a lint-free cloth, as you would do when taking a needle out for doing venipuncture or any other process, intramuscular injections, you slide the cannula out first and then apply pressure. and just check that the equipment is still intact. There's no chips or it looks like some has come apart or broken off, and that all looks intact, and that will go into the sharps bin. And apply pressure until the bleeding stops, and that might be, if somebody's on anticoagulants, that you need to stay there for quite a long time in order to do that. And document in the notes that the cannula has been removed, and then gloves and apron off and decontaminate your hands, and that's that.